All right, hi everyone. Today we are going to start our unit on psychological disorders. Lots of fun things to learn about. So, today we're just going to do an introduction to disorders and understanding how they're defined in psychology. So, you have the definition right on your slide. It's a harmful dysfunction in which thoughts, feelings, or behaviors are maladaptive, unjustifiable, disturbing, and atypical. So let's look at each of those words. So maladaptive means it is destructive to yourself or to others. So you're going to see harm coming to yourself or to others because of that belief. Unjustifiable means without a rational basis, meaning there's no real reason for you to have that thought behavior disorder. It is disturbing, meaning it is troublesome to other people. This takes into account cultural perspectives and changes over time and considered what is normal and what is not. And with that, you also have atypical, so meaning it's so different that it violates a norm. So in reality, you could have a behavior that would be considered a disorder in one part of the world and not in another part of the world. It is very important to understand that you need all four of those categories in order to be considered a clinical disorder. Okay. That doesn't mean you can have issues and it not be considered a disorder. It just won't be considered a psychological disorder. So psychological disorder needs all four of those: maladaptive, unjustifiable, disturbing, and atypical. If you don't have all four, but you have some of those, you'll have what's called a neurotic disorder. It's very distressing, but you can still function in society and act rationally. Excuse me. So let's talk about understanding our disorders. So in order to understand disorders, you really want to look quickly at the timeline of how humans have understood people who are having different psychological issues. Ancient Babylonians thought that if you had what we would consider disorder today, you were possessed by a demon and it needed to be treated through prayer and magic. Ancient Hebrews thought it was punishment for sin and you could treat it with prayer and atonement, doing good deeds. Ancient Greeks, like Socrates, thought it was a faulty thought process that could actually be treated through word recitation, so repeating words over and over. Very similar to the opening credits of Simpsons, where Bart Simpson is writing stuff like, "I will not throw garbage out the window," stuff like that, and just saying it over and over and over. You see it sometimes in how we deal with stressful situations, and you see people just like, "I can get through this. I can get through this. I can get through this," or just popped in my head. The little engine that could. I think I can. I think I can. I think I can. That's word recitation. By the 15th century in Europe, we're back to demonic possession. And the best way to treat that is through torture and execution. So people that had any type of hallucinations, visual or auditory, were often identified as being possessed or witches and were killed. By the 18th century in Europe, they recognized it was not demonic possession. They recognized it was mental illness, but mental illness was not treated at all. There was no hope that you were ever going to get better. So if there was any form of illness, you were locked in what is called an asylum. Or if your family wanted to make a little money, they could sell you to the circus and you could be displayed for the public. And people would get to see the disturbed person, whether that was in a freak show or having to show for medical hospitals, like learning hospitals. Your family could sell you there. It is not until we meet Philippe Pinel that you see the concept of the medical model being applied to psychological disorders. So he starts this movement to use humane treatment for mentally ill patients, saying it's not justifiable to send human beings to live the rest of their life locked up in cages. You can treat them. And he'll come up with the medical model, the basic concept that mental disorders do have physical causes. And if they have physical causes, they can be treated. Sorry, not just treated, diagnosed, treated, and in many cases, cured. And since moving forward from that point, we have seen lots of modern research into into mental illness and psychological disorders, and we have a lot of information in terms of different causes, biological, biochemical, as well as environmental. Those biological have been linked to several symptoms and disorders, making it easier to identify. Sorry, did I say environment? I didn't mean environment. In terms of, we do look at environment through therapeutic methods, but medical research doesn't take into account environment or culture. Okay, the idea is if you follow the medical model, if a mental illness is a physical disorder, then it shouldn't matter where you're living in terms of the presentation of that disorder. It might affect how your family treats you or how society accepts you, but the symptoms will be the same. Again, following that medical model. Okay. Moving forward is when you get the biopsychosocial model. So the biopsychosocial model is newer research looking at how biological, psychological, and social factors can combine to produce psychological disorders. So biological is when you have that genetic predisposition. So a biological example would be inherited disorders. So we'll talk about different disorders in terms of if you have it, how likely is it that your children will have it. That's an inherited disorder. For the psychological part, that's your thoughts or thinking patterns. So a psychological example of a disorder would be like perception and how you perceive what is happening around you or how people are interacting with you. And then the last is the social concept, so expectation and cultural focus. And this, again, is that behavior that doesn't fit in with society, so that can change depending on what society you're in. So regardless of those models, whether it's the medical model or the biopsychosocial model, they did need a starting point. How do we compile all this information and give psychologists a point to begin? And basically look at how can they classify disorders. Okay. So to begin, what's the purpose of classification? Well, you want to give information to whoever is trying to help the patient. So you want to describe the disorder to make it easily recognizable. The hope is that studying it over time, someone coming to the new standard can predict the future course of the disorder to see how much worse it's going to get or what is likely going to be new symptoms. Then you want to have treatment for the disorder that is appropriate. You're not going to try all different types if you already know a treatment works. And also it provides a starting point for research into what might cause the disorder. Globally, the classification of disorders is the DSM. That's the Diagnostic and Statistical Manual of Mental Disorders. It was first developed by the American Psychiatric Association. It is the most widely used classification across the globe. It released its 5th edition in 2013, the DSM-5. It includes 16 clinical syndromes, and you'll see that there's a lot of different disorders that fall within those 6 groupings of syndromes. In places where you have private insurance, like the United States, they do require a DSM classification before they'll cover therapy for a disorder. So you need to have a psychologist sign off that based on the DSM that yes, you have this disorder before they will pay for that therapy. Okay. There's the outside of that, which is positive psychology, where you study healthy people and how to make people healthy. And that's very un-DSM because it's not looking at any disorder. It's looking at how could you be better. So that's what's followed today for classifying disorders. It does vary between countries because remember that psychological disorder has to also fall into the atypical factor, meaning it does include societal aspects to identify that atypical behavior. So again, there might be a difference in the disorder based on where it is in the world. Okay. Your next slide in very small print, gives you a rundown of the different questions, basically how disorders are diagnosed. So does it present clinically in terms of a syndrome that they're used to? Then after that, does the person have a personality or intellectual disability that would cause basically like false readings for a disorder? Then they look at, is there an underlying medical condition that would cause that? So a big example for that, an easy one, would be in the late stages of someone who is infected with syphilis, they tend to have a very erratic behavior and can have hallucinations. That's not necessarily a psychological disorder because it's stemming from the infection, and if that had been treated, it would go away. So if you make it past the clinical syndrome, the disability, and then the medical condition, you're going to look at psychosocial and environmental problems. So is there outside factors that could cause this? There's a term today that's been going around more about a process where people are actually very horrible called gaslighting, where they basically make you think you're terrible. That would be a psychosocial or environmental problem. And then finally, a global assessment where the person is ranked by doctors, and they have to agree that this person would fall into the psychological disorder. You can't have just one individual who says, yes, you have a disorder. They would want to do basically like a peer review. So that's how we identify disorders. When it comes to being labeled with a disorder, there really is a negative bias against those who have been labeled with disorders. So many people are often hesitant to get a physician to sign off that they have a disorder, even though that's what they need to get treatment because of it. And there's a lot of studies into it. The most famous is the Rosenham study in 1973, which was part of Stanford University. Remember, they like to do a lot of psychological experiments. In this case, okay, they actually had a healthy person check into a mental institution, and within a day or two, they were given a disorder diagnosis. They were completely healthy, but it was assumed that they had symptoms. And that really kind of talks about the state of mental health up until very recently. So you have that issue in terms of people worrying about it, because once someone says you're something, that can stick with you, even if you're not, or if you're able to overcome it, it stays with you. You also have television having a major effect on how people look at disorders. Studies show that 70% of people with disorders shown on TV, so they're supposed to be presenting with a disorder, are shown as violent, or they're criminals. In reality, clear studies show 90% of the people who have been identified with disorders are not dangerous. But that's not what you see on TV. So you have the skewed public sense. There is greater acceptance in today's society. It still has a ways to go, but you are far more likely to hear about different disorders and learn about different disorders. And no one can really send you to go live in an asylum anymore without a lot of doctors signing off on that. Okay, so that's your introduction. For your assignment today, it's very simple. I'm giving you a list of all the disorders that we're going to study. And I really just want you to tell me the ones that you're really interested in. I'm going to assume you're interested in everything, but are there any that really stand out? You might not know what they are, so you can Google it. It's a very simple checklist to do. It could take you 30 seconds, but you could take the 5 minutes and quickly look at which ones you want to know a lot about. And I also left an other box in case there's a disorder that either you don't recognize on the list and what it falls under, or you think it's not going to be covered, but you'd really like to know about it. You can put that in your checkbox, and that will help me kind of plan on where we are and what I can spend more time on or less as we move forward learning about all of these disorders. Also, this is my cat, Dalton. Did I say that already? I made it for another video, but I don't know if that was my world history class. I don't know. But if I didn't, I want to make sure you knew who the cat was. All right, so that's it. If you have any questions, email. We'll start learning about specific disorders next class. See you then.